wife, they spent $400 to $600 every month on generic drugs, and he just wanted to say thank you for bringing down the price of drugs that he and his family will have to pay.
And Ben is nodding on that one because no one wants to raise the price of drugs. But you know what? Hang on for a second. We're going to take a break in a minute, but let's just start the callers. There's lots of calls on this one tonight. Let's go to Dahlia in Toronto. Dahlia, you're on LeDrew Live. Where's your position on this one?
Hi.
Hi.
Actually, to be honest, I'm a pharmacist.
Okay. Thank you for that.
Pardon?
Thank you for declaring that.
Thank you. And I'm just reporting like a situation. Let's have a closer look, okay? With all my respect to all the opinions, I'm just reporting a situation.
Okay.
Today, I've met a patient. She's 90 years old. It's the first time to see her. And it's her first time to come to pick up her medication just because she can't afford paying the delivery fee that has been added lately.
Right.
It's one example. Another example, all the time, tons of medications of generics have been back-ordered lately.
Right.
And one of the reasons is the current situation.
So, Dahlia, let's just get to the point on this one, though, and I hear what you're saying. Do you agree with the government's move to get rid of these, well, I'm going to call them, no one else is calling them, but they look like kickbacks, these payments back to pharmacists? Do you agree with that, first of all?
To be honest, what I really care about is the kind of service being offered.
And I appreciate that because you're a professional and you want to be paid for it, though. But don't you want to get a fee?
To be honest, what happened lately, I don't feel like it was for the benefit of the patient. The patient keep coming all the time asking about back-ordered medication. Patients are really not happy with the delivery fee. So I'm not sure what would be happening if even more fees would be added.
Okay, Dahlia, thank you very much for that. I hear your point on it. It sounds like we're getting a little farther away from a solution, but we're going to get a solution on this one tonight because the three of you, Susan, Minister, and you, are reasonable people. We're going to take a break and come back with more of your calls, more of your views, and we'll see where this one's going. Stay with us.
To reach us within the GTA, you can dial 416-872-CP24. That's 416-872-2724. Or from outside the area, call us toll-free at 1-888-863-CP24. Or if you're on the internet, you can send your email to LeDrewLive@CP24.com.
We're asking them to come back to the table and help us to build a new funding model that will accomplish those three goals: save money for the government and the taxpayers, keep pharmacy viable, and allow us to provide those necessary services that our patients have come to rely on.
And we're back. We're on this debate tonight. We're joined by the Minister of Health in Ontario, Deb Matthews, who's in London on the site. We're joined by Susan Ing, the President of Advocacy for CARP. And also in the studio is Ben Shenouda. He is with the Independent Pharmacists. And Ben, we were just talking. You're saying that your association and the independent pharmacists agree with the government for getting rid of these, as you say, the professional fees, I'll call in the vernacular, kickbacks. You agree with getting rid of that system?
Yeah, we support that. And we also support the reduction of prices.
You support Deb Matthews on getting rid of that system. You support the government on reduction of prices. And you're just looking for an alternative. It sounds like it's just a matter of reaching a bargain on this.
I would say yes. Yeah. I would like to go back to something the Minister have mentioned about the proposal we tabled this afternoon.
Yes.
The Minister.
She says a bit rich, I think, but she can speak for herself in a minute.
Yeah. I think the Minister did not have enough time to read it. We just sent it recently. But this proposal is securing enormous saving to the government and also asking for increase the reinvestment money we put back in the pharmacy. And this will fill in the gap we have now. At least secure that we give the patient the service he deserves.
Yeah. Madam Minister, we're going back to you. You just heard that. I want to give you a chance to respond.
Well, I certainly will take a closer look. The report I got was that we were putting $300 million back into pharmacy. That's our proposal. Take $750 out, put $300 back in. But what we're going to put back in is what Susan Eng is asking for. We are going to increase the dispensing fee, but we're also going to start to pay pharmacists directly for services that they provide that actually improve the health of the people they serve.
But
we actually believe that pharmacists have far more to offer the healthcare system that they're currently providing. We want to create a new way of doing pharmacy where we'll pay pharmacists for providing that service.
And let's just go to Susan before we go to the phone. Susan, it sounds like this would be a more transparent system. I know you're a lawyer.
Well, absolutely, absolutely. And that's the point here. And I haven't yet heard any of the pharmacists say they are willing to provide these services and get paid for them. They keep talking about increasing the dispensing fees. Now, I understand that they constantly talk about the advice that they give to patients. And once that gets properly formalized, I expect them to be paid for that. And similarly, I'm not so sure that the province really wants to be spending money on home delivery. It's one of those valuable services yet, but is that the sort of thing we should be paying for? So I think that really what we have to think about is where the money could go. First of all, from our standpoint, we very much support it because we believe that this will reduce prices for drugs for everyone, not only the ones that the province pays for. Secondly, we will expect to get better professional services that the province is going to pay for exactly. And furthermore, the savings are going to be redirected for listing more drugs on the formulary, which our seniors need.
Okay.
So obviously, we see this as a net positive.
I think everybody sees it as a net positive. Let's just see what CP24 viewers have to say about this. Let's go to Eon in Picton. Eon?
Hi, I have a comment on it and a question. I live in Picton, and it's not a big town by any stretch, but we're blessed. We have a local hospital, an emergency room. We have a family health team next door with a pharmacy there, and down the street we have 2 grocery stores on Main Street. Both have pharmacies, and we have a nice big Rexall in town. Now, right next door to that Rexall, they're building a large new complex, and sure enough, it's a Shoppers Drug Mart. Now, we're not a big town. We have quite a lot of old folk, and we have a lot of young people, but we seem to have as many pharmacies we can need right now.
Right.
And I noticed, yesterday when Shoppers Drug Mart held their annual shareholders meeting, they said with the kickbacks being eliminated, they were going to stop building so many pharmacies around Ontario. And it seems pretty clear that a lot of that $750 million was going straight to their bottom line, and that building that many pharmacies in small towns around Ontario just doesn't make a lot of economic sense unless there's hidden subsidies involved.
So, Ian, the bottom line is you're saying that Deb Matthews is right and she should keep pursuing it.
Yeah, that's exactly what I'm saying, but I do have a question for her.
Okay.
How are we going to make sure that independent pharmacists that are providing services get support, but we as taxpayers don't wind up topping up, the profit margins of companies with subsidies that we can't even see?
Eon, thank you very much for your call. Very articulate question, and let's just go to the minister and ask her. Deb?
Well, this is what we're talking about here is the new way of delivering pharmacy services in Ontario. Those independents that are really do provide that kind of extra care, whether it's help with chronic disease management like diabetes or asthma. That pharmacists that are providing that kind of care will now be paid for providing that kind of care. I think independents are very, very well positioned because they already have a close relationship with their customers, so they'll be able to move to that new model of actually practicing pharmacy in the community. And I'm really hoping the independents will embrace that new model of providing care to their customers. That's the way of the future in this province.
Ben?
I do agree with you, Minister, and we do embrace this model, and we would like proudly to be able to provide this kind of service. And I'm very happy and proud that the public of Ontario is appreciating the business and service the independent is providing. However, I have a question to the Minister. Of course, you understand that everything will take some time to ramp up. So, yes, we will be providing the professional service, but by the time we increase the professional service level and we get paid for it properly, this will take time. Are you willing to put some transition fund to help pharmacy to cope with this transition period? until we get the full reimbursement from the professional service?